Good evening, everybody. Please ensure that you are muted unless you have something to say or a question to ask. The next 2 minutes, you always will give a waiting time of 10 minutes. So in exactly 7:10, you will start. By my watch, if it's correct, it's 7:08. So in 2 minutes, you start. All right, so good evening once again. So today marks the beginning of our training program, and all things being normal as it started is going to continue until we complete, unless the unexpected happens. So make sure that you get yourself prepared and get to know that every evening, as we have all agreed, until we also agree to change the timing or the dates. But for now, what we have all agreed is the days are Mondays, Tuesdays, and Thursdays. The time is 7, irrespective of the date or the day. That is our consensus for the avoidance of doubt. All right. The 10 minutes that I said we give ourselves, it's not like something that is going to be constant, because I realized that we're 27. As soon as I said that we're giving ourselves some 2-3 minutes, some people went off. What can 2 minutes or 3 minutes do to you? All right. So if you think that it is always going to be 10 minutes, I'm afraid that is not going to be. It can depend. At a time will come when, as soon as we get the numbers, or as soon as we hit 7 o'clock, or as soon as I'm ready, we start. So don't make it look as if it's always going to be 10 minutes waiting time. Please, that is not it. All right. So our program, as we said yesterday, is going to be in modules. And our module 1, which starts today, is Introduction to Basic Andrology. Said basic because these are fundamentals. And as we move along, as we get to module 2, you see that the technicalities and terminologies will be advanced, and therefore it can be advanced andrology. All right, so we start with the basics. So what is andrology? So the term andrology is derived from the Greek word andros, which stands for male. And all of us know that the suffix logy means the study of. So you can have microbiology, hematology, sociology, physiology. Wherever you see the logy, which is the suffix, it will always mean the study of. So as the andros, which is the, so to speak, the prefix, stand for male, then to me like study of males. But in this context, it's not male as a human being. It's rather the male reproductive system. So andrology can therefore be defined as a branch of medical science that deals with the study of male reproductive system, including the physiological and other conditions relating to the reproductive health and sexual functionality. I hope that point this slide is very, very simple. So just to explain what the word andrology. Yesterday, I was trying to say that as we move along, you skew to the laboratory aspect, and therefore it becomes laboratory andrology, because the science of andrology will include treatment. Because once you're going to consider the conditions that affect the male reproductive health, then you should be able to manage it. And management is also treatment, and which treatment can also include surgical interventions. And you know that we are limited once it comes to the scope of managing a patient. All right. And therefore, all our discussions with respect to andrology will be skewed to the laboratory concept. So the laboratory andrology will therefore delve into the aspects of male reproductive anatomy and physiology, including semen formation. Okay, other topics covered in laboratory andrology, and for that matter, male reproductive pathophysiology. When you talk about patho, you're talking about diseases. So when you talk about the things that go wrong within the male reproductive health system. And then we also talk about genitourinary disorders. As we move along, you know that certain aspects of the genital tract coincide with aspects of the urinary tract, okay, and therefore become genitourinary. All right, and that is the area specific for the urologist. But in Ghana, I'm not sure we have people or clinicians actually specializing in andrology, becoming andrologists. So by and large, it is the urologists that take care of the genital conditions. We're talking about the reproductive health. All right. So most often, as far as I know in Ghana, the urologists are taking charge of the andrologic issues. All right, which is understandable. But I'm sure that as we move along or as time goes on, you can have people who are clinical andrologists, and therefore they will be specialists in the area of managing male reproductive health. We will deal with sperm DNA fragmentation and molecular markers for sperm quality. These are all aspects that will be covered in this program under laboratory andrology. So let's move on straight away. General overview of the male reproductive system. When I say overview, it means that it's been done before and you are like going over. All right. And all of us at one point in time have done the male reproductive system in school. Even as low as secondary school, we do the reproductive system. All right. So there are key points I want us to take note about the reproductive system. You know that the body has several systems. When we talk about systems, I'm sure this time we don't need to belabor that. You know, cells will combine to become tissues, tissues will become to combine organs, organs will combine to become systems. And you know that there are several systems that make up the entire human body. All right. And one of it is the reproductive system. One thing that is unique about the reproductive system is that it is the only system that differs between males and females. For example, if you talk about the cardiovascular system, okay, in respect to human beings, there's no difference between the cardiovascular system of a male and a female. If you talk about the GIT, okay, the GIT, gastrointestinal system, it is the same for a male and a female. If you talk about respiratory system, it is the same for male and female. You understand? But when you talk about the reproductive system, then you have a problem. The problem is that the reproductive system for male is different from the reproductive system of the female. So it is significant to know that of all the major systems of the body, it is the reproductive system that differs in terms of male and female. I hope that point is very clear, because you don't have a different GIT system for males and a different GIT system for females. Have different respiratory systems for males and then one for this thing. But when it comes to the reproductive system, then you have different for male and different for female. That is a key point that I want us to, we may know already, but this is an overview. So we're going over some of these facts. The reproductive system in both males and females do not function until puberty and work together for a common purpose. This one is very, very important. If you talk about GIT, right from birth to the time you die, the GIT system will work from, I don't know, I mean, from birth, all the system will begin to work. But once it comes to reproductive system, they don't work, they don't function until after puberty. Okay, so that's also very, very key. We have all the systems that work from day one up to the time that you die. But the reproductive system do not begin to function until puberty. Okay, so from childhood, yes, you have all the systems in place, but they will not function the way they should function, because they have to function to produce sperms and eggs that will combine to give you an offspring. And that's, that's procreation. Okay, so giving birth, but you can't do that until after a certain time. So it means that the organs that are supposed to function that way will be delayed until the time of maturity, where now you say, oh, now you can begin to produce sperms, and now you can begin to produce eggs that will now be able to accept the sperm for blah, 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 blah. I hope that point is clear. So these are fundamentals, or these are key points we know already, but since we want to say an overview, we need to bring them out again, that the reproductive system in both males and females do not function until puberty. And once they begin to function, they begin to work, their main purpose is for procreation. All right. Now let's come to the male reproductive system. It is responsible, their responsibility is to deliver. In fact, they have to produce sperms, deliver it to the female. All right, so that's the major responsibility. All right, when it comes to the male reproductive system. So take a look at this picture. It gives you all the important structures that make up the male reproductive system. All right. So the male reproductive system consists of several organs acting together to produce sperms, of course, seminal fluid, and male sex hormones. These are the major functions. All right. So, and they consist of certain structures and organs that will work collaboratively to give it the result that we want. All right. So take a clear look at, let me see if I can activate my pointer. Unfortunately, I've lost my pointer, so I'm trying to use the one from the from the system. I don't know how it will work. If it doesn't work, you pardon me for that. I'm just trying to see if I can get my printer. Sorry for that interruption. All right, so I'm hoping that, unfortunately, I'm unable to access my printer. So let's see. No, I can't get it. So, but you see that from the right, you see the glass penis. You take each of them one by one as you move along so that you appreciate, understand them more. But this is the overview of the male reproductive system. Take a look at the picture. You have your glass penis. You have the prepuce, which is the foreskin, and then you have the penis itself there. These are aspects, the glans penis and then the prepuce are aspects of the penis itself. You deal with them individually. All right. So you have, of course, the scrotum, and then you have the penis here lying on the scrotum, and then the testis lying or being housed within the scrotum. And then, of course, epididymis, which you see it as a C structure of a sort. And then from the epididymis, you get the what we call the vas deferens. Okay, the vas deferens, as we move, like I've said, we are going to take them one by one, and you see them properly, you appreciate them properly, and then you also appreciate their functions. All right, so you get that one, and then from where you have the vas deferens, you see the structure, the seminal vesicles here. The seminal vesicles is on its own, but the duct, that's the what sends the fluid out of it, which is the duct, is merging with the vas deferens somewhere here, become one, and that's the ejaculatory duct. And this ejaculatory duct, you see that is straight away within the structure here. Unfortunately, I'm unable to get a pointer. I don't know if anybody can help me access the pointer. I don't know where I can access my pointer. Do you have anybody that can help me access my pointer? I hope all of you can hear me. I hope so.
Yes, please.
Okay. I'm trying to see if I can get a pointer on the assembly. I don't know where I can access it. Good. I got it. So can you see my pointer, please?
Yes, please.
Okay. So this is what I'm talking about. So this is your epididymis here. And like I've said, we're going to take them one by one. Epididymis here runs up here, and then over here, before it gets to this portion, it enlarges. Okay, enlarges to form what we call the ampulla. Like I've said, as you move along, you see all of them. And then there's the vas deferens, seminal vesicles. So the outlet of the seminal vesicles is joining with the ampulla of the vas deferens to form another entity here. And this is the ejaculatory duct. And you see that this whitish thing here is the prostate. So you see that the ejaculatory duct is opening into the prostate. All right. And then from there, you have the urethra, which is also moving out here. So we are going to take them one by one, and you see how they work out. But this is a very good picture. I want you to look at very well. So like we said, once the male reproductive system begins to work, then their main function is to produce sperms and deliver it to the female for the purposes of procreation. So this is just a picture to demonstrate the male sperm and then the female egg coming together to form a zygote, embryo, and of course the baby. So this is the part or the role of the male reproductive system within the entire reproductive system of the human being. Right. This another picture also demonstrating the structures that make up the male reproductive system. All right. So it's an enhancement or a clearer part, a clearer portion of what you saw earlier. So this is also the penis, and then this is an important part, the glands, the head, which is also called a glands. It's very, very important. You take all these things one by one and deal with them. All right. So you have the urethra here, and then it comes out here. The orifice or the point where it opens is called the meatus. meatus. We will deal with all of them as we move along. I just wanted to have an overview of all the different parts. If you look here, this is ductus deferens. If you go back, what you saw here was vas deferens. But it's the same thing. Look at this duct here. This duct here. And this is the lip, vas deferens. And when you come here, it's the same duct here. And it is called ductus deferens. The difference is that some people describe it as a duct. Okay. And then, so it becomes ductus deferens. And then others is just a vessel. So it becomes vascular. So it is vas deferens. That's the difference. So you can name it if you see it somewhere which is being named as ductus deferens, and somewhere you see it as vas deferens, it's the same thing. One is considered as a vessel, one is considered as a duct. That's all. So whether it's a vessel or a duct, it is the same. All right. So as we move along, you see here we have erectile tissue. And this is the penis. And as we move along, we're going to deal extensively on the erectile tissues of the penis, because a penis without erection is no penis. All right, so you have the erectile tissue there, and you deal with them and see how they function. If I'm moving too fast, you draw my attention because you need to understand everything as much as possible. Right. This is also another labeling of the same male reproductive anatomy. The same thing. You have your scrotum here, which is just the sac containing the testis. You have the epididymis, and then the vas deferens or the ductus deferens. All right. And then the same labeling. Once you have the slides, you can take your time and then study them properly. But I want you to identify all the important structures. We have the carpus gland here. Elsewhere, it will label as carpus glands will be labeled differently. Look here. Okay, this is also carpus glands, but let me see where you have a different. This is also bulbourethral gland. So bulbourethral gland, if you look at it very well, there's a small gland here which opens into the urethra. And then you see that it is the same thing here. It is the same thing here, which is also opening into the urethra. So you see that corpus gland is the same thing as the bulbourethral glands. So some of the labelings will differ, but I just want to point out where the commonalities are. All right, so the carpus glands, bulbourethral glands, and then the ductus deferens, and then the vas deferens. But like I said, once we take them one by one, we will deal with them appropriately. Look at here, this epididymis. This is spelled with MIS. You see elsewhere it is spelled with MES. We take a look at all these things. What is the meaning of epididymis with MES and the difference between that one and epididymis with MIS? All right. So this is all different labelings of the same male reproductive system, and then you appreciate them as we move along. I've said over and over again that you're going to take them one by one. All these things you see here, you're going to take them one by one and deal with them so that you see their role in the entire male reproductive system. So When you look at the male reproductive system, let me go back again. You realize that this, for example, this is the testis, the scrotum, this is the penis. They are outside the body. You see, if you look at the human body, the systems, you know, we have visceral systems or visceral organs. These are the organs that are within the body. Okay, for example, the heart, the lungs, all those things, they are all visceral. They are soft tissue organs within the body. Okay. So if you look at the male reproductive system as you have here, you see that some of them are outside the body and some of them are inside. And therefore, as you move along, those that are outside the body are sometimes described as external genitalia. Or you see, the genitals is talking about the sex organs. Okay, so when you see external genitalia, you're talking about the penis and then the scrotum. Then you see that the scrotum also contains the testes. So technically, you see that the testes, because it is within the scrotum, then it can be part of the external genitalia. However, if you're dealing with then the whole thing, you see that it is also part of the internal systems. So when you are talking also about the internal genitalia, sometimes the testes also become part of it. Don't get confused. All right. The external genitalia, those that lie outside, primarily you have the penis and then the scrotum. But the scrotum also contains the testicles. As you move along, you also understand the difference between testis with TIS and testis with TES, and then testicles. So you'll be using them interchangeably, but you should be able to understand what's the difference between testis with TIS, testis with TES, and then testicles. When you use them, what is the actual meaning? As you move along, you understand all these things. All right, but what I'm saying here is that when you talk about the external genitalia, technically it is the penis and then the scrotum, but the scrotum also contains the testis. So to some extent, you can say that the testis is also an external genitalia, but you see that it's also inside. So when it comes to the internal male reproductive structures, we also will mention the testis, but you will not mention the scrotum as part of the internal structures. I hope the point is clear. All right. So the male reproductive system consists of external and internal organs. That was what I was trying to explain. The external male sex organs, which we often refer to as external genitalia, are the organs located outside of man's body. And they include, of course, the penis, as I've said, and then the scrotum. But of course, the scrotum also contains the testicles or testicles and the supporting structures. These are very fundamental, and I'm sure that you appreciate and understand them. Then, of course, when it comes to internal, like I said earlier, if you look at it from the outside, then you see that testis is supposed to be part of the external genitalia. But when I say something is internal, internal means internal. It means that it's also within something. So it also qualifies to be described as part of the structures that form the internal organs. Okay, right. And then, of course, after that, the testes also have the epididymis and then the vas deferens, seminal vesicles, prostate, and the bulbar urethra, which we said also called the corpus glands. They constitute the internal male sex organs. All right. So now we're going to take them, the external genitalia. Primarily, we said it is the penis and then the scrotum. So we're going to deal with that one first. Okay. So the external genitalia, the penis, and then the scrotum. Let's deal with that one. So the penis is derived from Latin word penis, which means the tail. And you appreciate that even in our local parlance, they will say if they are going to circumcise a child, so have you heard that one before? So they know that a penis is called a tail. All right. So it comes from Latin where penis, which is spelled ye with this kind of structure on it. So I'm not sure it's called penis, but maybe penis or something like that. But it's a Latin word, penis, which means tail. And I'm saying that our traditional men, our traditional culture also accepts the penis to stand for tail. All right. And I'm saying that it is so because sometimes somebody will tell you, our mothers in local parents say, what you bra. You understand? If they say they are daring you, say, oh, yeah, bra. But you know that human beings don't have tails. So it means that once they say udia, they know that you're talking about the penis. This is very, very important. So the tail is the Latin representation for the word penis. I'm sure probably you know this already. It's just an overview. It is the major external reproductive organ, okay, for copulation. Copulation is the medical terminology for sexual intercourse, okay? So to copulate, as you move along, you understand words like micturition, which means urination. When you urinate, technically, medically, you don't say urination, you say micturition. The same way, sexual intercourse is copulation. So the organ using for the sexual intercourse, we call it the copulatory organ. So it means that the penis is serving as a copulatory organ. That's the means by which you can have sexual intercourse. Okay, so that's the role it is playing. Then secondly, it is also playing the role of an excretory organ because the urethra within the penis will carry urine and pass it out. All right. And like I said, urination is medically called micturition. So these are the two major functions of the penis: copulation, using it as a means for sexual intercourse, and then also using it as a means to pass out urine. So because these are two main functions, we say they have dual functionality. Okay, when it's we say something has a dual purpose, it means that it has two uses. So when it says dual functionality, it can have it can also serve certain functions, but primarily we are saying that it has a dual function. Okay, so this dual function is describing an aspect of the penis under the urinary system. Okay, because the under the urinary system where you can have urine out. And then you can also have an aspect of it under the reproductive system. That's where you can also have semen out to also go and then do the fertilization. So that is the aspect. So now let's see some important things about the penis. All right. So all right, so let me also add here. So because the penis is playing this dual role of being used as a reproductive system and also being used as a urinary system, it is called the urogenital organ. Okay, the penis is an organ which is playing the role of a reproductive system, also playing the role of a urinary system. Okay, so it is urogenital. Genitals got to do with sexual organs. Okay, so urogenital or genitourinary, whichever you want to call it, urogenital or genitourinary. Once it comes to the urethra, you see that the urethra is also playing the same role. All right, so you also see how we describe it. But the penis is described as a urogenital organ or genitourinary organ. All right. So let's see, we want to get ourselves whipped up with some small things, because sometimes you there as a scientist, somebody will come and tell you, oh, my penis is small. All right. If the person has gotten to the point that the penis will not grow again, you have to be able to tell the person that, no, at this point, your penis is still growing. So don't worry, it will become big for you. You don't need need to go in for anything. Sometimes the person is at a certain age, no. At this age, the penis cannot grow any longer. So manage with what you have. Even though these days our ladies appreciate bigger and longer ones, but if you are already, let's say, 30 years, your penis is what it is. And so as you move along, you should know at what point the penis will grow and at what point it will not grow. That's why the slide is there to help you, so that once somebody approach you with some of these challenges, you know how to advise accordingly. So the penis grows minimally between birth and puberty. All right. Remember that we said that the reproductive system of males and even also for females do not function. Okay, they don't function as they should until puberty. All right, so if the thing is not going to be useful until puberty, why must it grow? Okay, so the growth there is very, very minimal until, so within puberty, that now it is time for it to be used for the function, which is copulation and sexual intercourse. And if it's going to be copulation and sexual intercourse, then it means that it will get a certain weight and length to be able to function, and therefore naturally it begins to grow, it begins to lengthen, begin to get wide. All right. So you don't see somebody at age 10 and the next 2 years you see the penis has become big. Say, hey, within this short time, your penis has become, so it means that the person is now within the puberty period. And once within puberty period, is bound to get all the energies and resources for the penis to grow. All right. So the growth from birth to puberty is very, very minimal, almost, very, very negligible. All right. During puberty, and you know that these days puberty has come down to as low as 10 years. In fact, we have heard about some 10-year, especially the ladies. Some of them will begin puberty at age 9. But for males, I think, so if you have a 10-year-old boy, it is possible that you can also impregnate somebody. That's what it is. All right. So during puberty, and it is technically between 10 to 14 years. Of course, some people, puberty may delay, but on the average, puberty begins between the age of 10 and 14, where hormonal changes will begin to take place. And then they will drive an increased production of testosterone, which will trigger, you know that testosterone to one of the key functions is for the activation or characterization of the secondary sex organs, including your penis. All right. So within the puberty period, there is that kind of an increase in testosterone production that will trigger the penis growth. And then the growth will occur both in length and girth. Length, of course, you know how long. Girth is the circumference, because as you move along, you see that penis is cylindrical. So if something is cylindrical, you are going to talk about the circumference. All right. So the girth is the circumference. All right. So the growth will occur in both the length, long, and then the circumference. That's why I'm talking about the girth. Okay. So it's also important to know that testosterone levels peak in the late teens, let's say from 16, 17, 18. Or at those stages, testosterone levels are always very high. Okay, and they are to drive the growth of the secondary sex organs, including the penis. Okay, so puberty can last 2 to 5 years. And once puberty ends, there is unlikely to be any further penile growth. This is also important. We said that within the puberty period, that's where there is this kind of marked increase in testosterone production, which will trigger the penile growth. Now, once puberty is over, I know puberty is a period. That period is within two. So if somebody starts, let's say, the puberty begins at 14 years. At worst, by 15 years, puberty is over. It means that it's reached an adult stage, so to speak. If the puberty starts around 14 years, it means that maximum by 19 years, because the testosterone, which is actually triggering the growth of the penis, will also begin to wind down, okay, in the late teens. That is in the late, let's say 18, 19s, and then early 20s. So by 2021, your puberty is supposed to have completed. All right. We have to know all this so that when somebody comes to you, you also be equipped with the right knowledge to also advise. So by maximum age of 2021, technically puberty is over for almost everybody. And therefore, after puberty, the size of the penis is what it is going to be. Unless I'm told that some people go to the north, there somewhere in the north, and then and I don't know whether it is true. Those of you come from the north, you can say whether it is true or not. That they go and take some medications, and then your penis can grow 100 times. I don't know about that, but scientifically, once puberty is over, the penis is expected to also not grow any longer. All right. So this about what I'm saying. So the penis grows slowly, and then it slows down, and then stops between 18 and 21, which coincides with the end of puberty. That's why we're saying that by the time puberty is over, and puberty will be over depend on when puberty actually starts in the individual. Some people's own will start very early. And so once it starts early, it means it's likely to end early. Some people start late puberty, and therefore puberty also end likely to also end late. Okay. Whatever be the case, on the average, by 21 years, puberty is expected to be over. And that is why we're saying that at that point, you've reached an adulthood. As far as the penis is concerned, it will not grow any longer. So the average length of a flaccid penis. All right. So when you talk about flaccid penis, we're talking about a penis which is not erect. And the next line will talk about that. So we say the thing is no longer growing. So what it should be the average length? So the average length is expected to be about 3.5 inches in the flaccid penis. That's the penis which is not erect. It's supposed to be 3.5 inches or 8.8 centimeters. That's the average. So it can be longer or shorter than this. As we move along in later stages to abnormalities, then you know which is, for example, a small penis or what we call micro penis and so forth. But for now, we're dealing with the under normal circumstance, what is supposed to be. All right. So on the average, once it is also erect, it's supposed to be around 5.1 inches, that is 12.9 centimeters. So you should have this averages so that you know whether it is too long or too short or something like that. So we describe a penis as flaccid, or when it is not erect and when it is at rest, soft and hanging loosely. You see, we use the word pendulous. I'm sure you know about a pendulum. Hello? I'm sure all of us have an idea about a pendulum.
Yes, please.
Yes. So a pendulum will be swinging. And once to be swinging, it means that it should be freely hanging. Is that not it? So when you talk about a pendulous penis, you're talking about a penis which is in its loose state. And that's a flaccid. That's why you sometimes call it a pendulous penis. That's the flaccid, which is at rest. And therefore, once it is at rest, it is likely, especially if you don't have panties, you see that it will be moving left and right, and that like a pendulum. So that's why you call it a pendulous penis. Then you can have a pendulous breast. You know a pendulous breast. And when the breast is also it is hanging, it's also a pendulous breast. You can even have a pendulous belly. These days, you see some women, then you see that their belly is virtually hanging. I don't know. I don't know if that's what they use for the BBL or something. I don't know. But you see that, and these days too, they like wearing trousers and what have you, and you see that their belly is actually hanging. That's also a pendulous belly. And those people, especially if they become pregnant, then you see that the belly is actually hanging as if it is falling off. That is also a pendulous pregnancy. So you should understand how to use the word pendulous. So pendulous is an adjective describing the fact that the penis is hanging loose and can be just be moving left and right. Okay, so the same state of the penis can also be called a urinary penis. The urinary penis, remember we said that the penis is going to perform two functions. One is for urination and one is for copulation. For copulation, it must erect before you can use it for copulation. I hope you understand that one. We've seen that the penis has two functions, one for urinary, one for copulation. Copulation, it can only penetrate once it is erect. And we are saying that a penis which is not erect is flaccid. It means that once it is flaccid, you can only use it for urination and not for the other thing. So you can describe a penis as a flaccid penis or a urinary penis. A urinary penis is that one which is just hanging, not doing anything. If you become old, then it can no longer erect. You can just describe it as a urinary penis because that's all that you can use it for and nothing else. So some terminologies, you can meet them and should be able to appreciate why they are called so. All right, so a flaccid or urinary or pendulous penis is that one which is not erect and it's at rest, very soft and hanging loosely and can just move anyway, anyhow. Okay, that is it. And I've said that the pendulous can be used for anything which is also loose and hanging. And I've given you examples about a pendulous breast and a pendulous belly. All right, so in the flaccid state, penis is usually cylindrical in shape. Okay, and when it is erect, it assumes what we call a triangular prism shape. Take note. It is cylindrical in shape when it is flaccid. But once it is erect, it loses that cylindrical shape and becomes triangular. I'm sure you know a prism. So the base will be bigger, and then the top will be smaller. Okay, and it is round too. So we describe it as triangular prism with rounded angles. So these are all descriptions of the penis, and you need to appreciate them. All right. So the penis anatomy, the anatomy of the penis. All right. Sorry, I have to get something here. All right. So the penis is anatomically divided into three major parts. Okay, so you have this one as the penis, and then you have the base, which is also called the root or the radius. I'm bringing all these things out because sometimes you read somewhere and you are going to meet radius, or you are saying root or base, so that this is just to help you appreciate the fact that these are terminologies that can be used interchangeably. All right. So the base or the root of the penis, and then you have the body. Okay, of course, the body, and then so the body looks like a shaft. I'm sure you all of us know what a shaft is. And then it's also called a corpus. The corpus because we said that this part contains a lot of erectile tissues. All right. And then the erectile tissues, as you move along, you know that the corpus cavernosum and corpus spongiosum. So the corpus is used, not the corpus christi, please. Those of you are Catholics. So the corpus spongiosum and corpus cavernosum, because they make up the major part of the body here. The body is also sometimes called the corpus. All right. And then it looks like a shaft. Okay. And then it is the main body. So that's how come those can be used that way. And then we have this part called the head or the glans, the head or the penis. So as we move along, we're also going to take them the root, the body, the glands. You're also going to take them one by one and see the architecture and then their main functions. All right. So you're going to take them one by one, the base. So the base, also known as the root or radius of the penis, is the section of the penis that attaches the penis to the body. All right, I'm sure that one is self-explanatory. And it provides stability and support. The root forms the portion closest to the body and the most proximal and the most fixed part of the penis, and it's not visible. Let's go back and see all these things. So this is the root. And those of you who are males, you can just appreciate this better. Even the females too. I mean, you are all mature and you know penis very well. So you see the root. So this part is fixed to the pubic bones. So it makes the root part very fixed. All right. And it gives the whole penis the stability. Okay, it is fixed. If you look at the penis in its entirety, this is the proximal side. All right, this is the proximal side. So it is the most proximal, the part which is farthest away from the tip, and also the closest to the body. And then if you look at the penis properly, if you want to look at penis, everybody was looking at the body and not the, in fact, this part is virtually not visible because this is the part which is actually fixing the penis into the body. All right, so it is virtually almost invisible. Okay, so this is the description of the base. And then the body. The body of the penis, also called the shaft or the corpus, form the main body of the penis. This one is also self-explanatory. It is elongated, cylindrical, three-part of the penis, and is located between the root and the head. I'm sure this one too is also self-explanatory. It is the body is located between the root and then the head. Okay, I said that the head here is the glans. All right. Okay. The head or glans of the penis is the enlarged or bulbous, cone-shaped tip end of the penis, and that forms the most distal or apex portion of the penis. Let's go back and see what we're talking about. When you say something like bulbous, it means like a bulb. All right. So this is the enlarged portion. Bulbous, it looks like a bulb. Okay. All right. And the most distal, because we said that it is the entire body. The root is fixed to the body. So this is the farthest away from the body. These are all antics, but you should be able to appreciate them. All right. So the head is the bulbous, and it is cone-shaped. I hope you can appreciate it. A cone is, a cone. All right. So if you have a cone, the cone should have a base, which is also rounded. Okay, it should have a tip. All right. So the penis is just like a cone, especially the tip. All right. So it's also the farthest away from the most distal from the apex portion of the penis. All right. All right. So, and it contains the urethral orifice. You know that the penis will contain the urethra. The orifice is the opening, the end. All right. And normally the tip will open, so the urethra will open at the tip of the penis. And that portion is called the meatus. And it is through this meatus through which you have your urine and semen exiting the body. Okay. So the glans penis is rich in nerve endings. As we move into the next aspect, especially about erection, you see what role the nerves play in erection. So if the glans penis is rich in nerve endings, it means that if somebody wants to, and always know, if somebody you want to stimulate as you have to have some sexual stimulation, the best place to touch will be the glands, that's the head of the penis, and not the body. Or even those women would like to massage the body, but actually the area that has the richest amount of nerve endings is the glands. Okay, so that should be your target area, all right, for stimulation. Now, we still have the glands, the head, and then we have the corona. Remember, we said that the glands, which is the head, has a cone shape. This cone has a conical shape. Okay, so you have this as a cone or something, and there's a round base like this. So this, it has this crown, and you see this one in the circumcised males. All right, so this is a crown-like structure. Okay, now this crown-like structure is called the corona. Okay, not coronavirus, the corona of the penis, which you also call, because it is crown-like, it's also called the penis crown. The penis crown is not the head. It is that ring here, which is called the penis crown or the corona. All right. It is important because you have to know that this is the glans and this is the shaft. Okay. So this serves as the boundary. So over here, you get the skin of the shaft and the skin of the glans meeting here, meeting at the corona. So it's very, very important to get that understanding. All right. So it is that specific anatomical area where the skin of the shaft meets the skin of the glans and where the foreskin attaches the glans. Here, you know that this is a circumcised penis. So in the uncircumcised penis, then the foreskin is that loose skin, which is also covering the glans or the head. So the foreskin is also attached to it. So this portion is very, very, very delicate and important. All right. So the next important information is that the circumference and the underside of the corona, see the circumference, that's around, and the underside here is densely innervated. Remember, we say when we say something is innervated, it means that it has a lot of nerve endings. And we say that as we move into area of erection, you know that you need to stimulate, you have to get some sexual stimulation. So if you want to get some sexual stimulation, you should know which area is highly erogenous. When you say erogenous, that it has the tendency, when you say something is erogenous, it has a tendency to give you erotic emotions. Erotic means like a sexual feeling of a sort. I hope you understand that already. All right. So if you know this information, you know that, oh, to be sexually stimulated, all right, to be sexually stimulated, you need to get your erogenous zones. Erogenous zones, and especially with the men, if you have a lady, you want to know which area, if once you touch, get the person aroused fastest. So if she's your girlfriend already or a woman already, you know which area to touch to arouse her. So for a man, some of the sensitive areas that will give you that kind of sexual stimulation is the corona area. All right. So the corona and then the underside. Why? Why should that be erogenous? Erogenous because it is heavily innervated. Innervated means a lot of nerve endings. So, and nerves, as you move along, you see that nerves play major role in erection. All right. So once you have a lot of nerves on the circumference of the corona and then the underside here, then it means that if you want to be sexually aroused, that's the source you have to play around. I hope that point is clear. Right. Right. Some more important information about the glands of the penis. And of course, we know that some penises are circumcised while others are uncircumcised. In the uncircumcised male, the glans penis is covered. Remember, we said that over here, this is a circumcised penis. In the uncircumcised, this glands is covered by a skin, a very soft, loose skin, which you call the foreskin. All right. So in the uncircumcised males, the glans penis is covered by a retractable. When it's a retractable, I hope you understand. You can push it back and forth. All right. So it's a loose skin. We call it foreskin. This foreskin is also called a prepuce. Right. In covering the glans, it gives it protection and also gives some lubrication of the glans, and of course, lubrication to assist in penetration during sex. All right, so that is the main function. But by and large, remember that we said that the foreskin, which is removed during circumcision, all right, should be retractable. That is, should be able to move to and fro. You should be able to push it back and forth. All right. Now, there's a condition called phimosis. Phimosis is where the prepuce is there, the foreskin is there, but it cannot be retracted. It cannot move up and down. And there's also what we call paraphimosis. Paraphimosis, we will deal with all this in details. Paraphimosis is when it can move back. It can move it back, but it cannot return it. That's paraphimosis. But if the foreskin cannot be moved forth and back, then that's phimosis. Now, in children, when they are born, they lack the ability, the foreskin lack the ability to be moved up and down. So it means it's creating a condition of phimosis, because we say phimosis is where the foreskin cannot be moved. It's supposed to be retractable. When it cannot be retracted, it is phimosis. But in children, the newborns, up to the age of about from 3 to 4 years, the foreskin cannot be moved. So it means that there's phimosis there. But it's a physiological condition. The physiology is normal. Children, newborns are supposed to have that kind of intact foreskin. So if they have an intact foreskin, it is phimosis. But is it abnormal? It is not. Unless after 4 or 5 years, there's no circumcision, yet the foreskin too becomes, let's say, non-retractable. Then you can talk about pathological phimosis. I'm hoping I'm making some point here, saying that because you have to know all this, because as scientists, you can find yourself elsewhere. Somebody can come and complain to you that, oh, my child, blah, 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 blah. And, oh, you can say it is normal. It is normal. And then you can, because you say it is normal so that the person's anxiety can be resolved to some extent. I hope that point is also clear. So the fact that the first thing should be retractable, and the fact that it is not retractable is called phimosis. And we're saying that in the newborns, up to age of 3 to 4 years, it is not retractable. So it is phimosis, but it is normal. So you call it physiologic phimosis. Good. And then you said that the foreskin, normally once you want to, if in the uncircumcised, if you want to retract it, as you retract it, you expose the glans. Sometimes some people, when they are adults and they are uncircumcised, they want to deceive. Females don't like uncircumcised penis. A lot of them anyway. Some do like it anyway. So sometimes if an adult is uncircumcised and you want to deceive the female partner that is circumcised, then during sexual activity, you will intentionally retract the foreskin. So the lady will not see that the thing there's no that is not circumcised. You won't see it because you see the glans penis. Actually, in the uncircumcised person, the glans penis is covered by the foreskin, which is the prepuce. All right. Now you know that circumcision is an elective procedure. When you say elective procedure, it means you decide either you want to do it or you don't want to do it. And if you want to do it, at what time? But you see that, however, it is regarded in some cultures and regions as a cultural mandate that, I mean, you whether you like it or not, you have to be circumcised according to some religion. I hope you are not confused. I'm saying circumcision is an elective procedure. It is something that you decide. When you say elective procedure, it means that you decide that whether you want to do it or not to do it. And even if you want to do it, at what time you want to do it. Okay, so you consider all those aspects with your clinician or physician as to when to do it and blah, blah, blah. So it becomes like elective. But I'm saying that, however, it is regarded in some cultures and regions as a cultural mandate. So it means that one too, you cannot decide whether you want to do it or not to do it. It will be done for you at all costs. All right. So that is just a little information there. And then the frenulum or frenum is a sensitive band of tissue on the underside of the penis that connects the foreskin to the glands. It is also very, very important because you know that the frenulum connects foreskin to the glands. And we also know that at that same point, it also connects that with the corona. And we say that that side is also highly innervated. So, and you know that during the circumcision, they have to remove the covering. That's the foreskin. And the foreskin is attached to the glands at this point. So what all that is saying is that if you don't take care, doing some circumcision, if you don't have an experienced person, before you could say, Jack, it cuts all your nerves at that area, and then it's like you are male, all right, but you lose your erogenous zone, all right, so that even if somebody touches that place, you don't feel anything, all right. That's just by the way. Right. We're still on the glance. There are some important aspects that you need to know. The noticeable, visible, when I say noticeable, it means visible, hypo or hyperpigmented line or ridge of tissue along the ventral side. That's the underside of the penis is called a ruff. Okay. So it is important to know all this because as we move along, we go to, once we get to the abnormalities or normal condition, you see that the ruff becomes very, very important because we said that the urethra will open at the tip of the penis. Sometimes it doesn't happen that way. We have hypospadias where instead of the urethra opening at the tip, it will open along the ruff. And that's the line, that's the visible line along at the underside of the penis. All right, so it is important to understand all these genital terminology. I call it genital terminologies. These are terminologies associated with the genitals. All right, so once you say the ruff, you should appreciate what it is. And the men, all of us will appreciate that from the meatus, and we said that the meatus is the orifice or the opening of the urethra at the tip of the penis. Right from there, you see that there's a line which passes along the ventral side, that's the underside, through the scrotum side up to the anus side. All right. So that line is called a ruff, but sometimes it's called median ruff. Median ruff because it is typically midline. All right. So I just want us to appreciate these genital terminologies. And say genital terminologies, these terminologies are associated with the genital tract or the reproductive system. All right. So that's once you're dealing with some of these things, you have to be able to appreciate them, understand them wherever you meet them. All right. So the ruff is that line, very visible. It can be hyperpigmented or hyperpigmented, but it's still visible. All right. Now, so it's called just the ruff. But sometimes you can come across median ruff. Median ruff because it is typically midline. All right. And it can also be called a perennial ruff because it runs from the meatus. And we talk about the meatus as the opening of the urethra at the tip of the glands. So it runs from there right through the scrotum up to the anus. And you know that the space between the scrotum and the anus is called the perineum. All right, so therefore, that line is sometimes called perineal raphe. I hope you also get that point very well. Right. So now this is how some people also describe this raphe is the line that runs on the underside. But some people describe the perineal, the one along the penis itself as the penile raphe. The one that, you know, that line passes also through the scrotum, it divides the scrotum. All right. So that line, which is also cutting across the scrotum area, is also the scrotal raphe. And then from the one that also crosses up to the anus, you know that from the scrotum to the anus is also the perineum. So it's also called the perineal raphe. So whichever way you meet it or however you say it, this is how it is. The raphe is that line. And I'm saying that it has to be appreciated because once it comes to the defects, you can have a situation where the opening, the what do you call it? The urethral opening, which you call the meatus, instead of it opening at the tip, it will open anywhere along the raphe. Anywhere along the raphe. It can open. So if you know where the raphe is, and then you're saying this, then depending on where it is also opening, then you can have what the hypospadias can be described as this. Once you get there, you also appreciate it. All right. Can we have just some a pause and have some questions, if any, from any of you? I was expecting as we move along, you may ask questions. So far, no questions have come up, but let's break for some 5 minutes and then ask questions, if any.
Grandpa.
Yes, sir.
Okay, my question is for you to be circumcised.
Yes, sir.
Is it not determined by your parent at birth?
Yeah, that's why I've been saying that in some cultures, all right, if you go back to that slide, you see that I said that it is supposed to be elective. Elective means that you decide when you want to have it done. All right. Okay, it's not an emergency. Now, I just want to see where I have it. Okay. So, but in some cultures, in some cultures or religions, it's a mandate. So as soon as you are giving birth, no, before you could say Jack, within 1 week or 2 weeks, they have it done for you. So you have no. But I just want to say that technically, it is not an emergency condition. I hope you are getting my point. Yeah. So, but some cultures, they don't. In some cultural settings, they don't do it. In some cultural settings, they don't do it. I'm told that if you want to be a chief in certain tribal sects, they don't circumcise you. Okay. Unless, let's say, you grow up and then you decide that, okay, me, I'm not interested in any chieftaincy. So I'll go and do it. Then you go and do it. But technically, it is not supposed to be something that should necessarily be done. But if you find yourself in a culture where it is mandatory that it has to be done, why not? Okay. Have I answered your question?
Okay, thank you.
Okay.
Grandpa, this is Alex.
Yes, sir.
My question is, so in a situation whereby after puberty, still now it grows.
After puberty, in every situation, I mean, you can have some odd thing coming out. If let's say there's some hormonal imbalance that's causing your penis to grow even after puberty, then you can seek medical attention, because if it also grows, it gets to a point that you yourself become embarrassed. I hope that you're getting a point. Hello. Hello, Alex. Is Alex off? Hello, Alex.
I think he's gone.
Okay, so you see, in everything there are checks and
Hello.
balances. There are checks and balances, especially with the hormones. You see, as
Okay.
we move along, we talk about erection, where you have the parasympathetic nerves and then the sympathetic nerves. You see, as one is increasing, the other one is automatically shut down. Okay, so those are the, we have homeostasis. Homeostasis, that's the total harmony the body should have. So as something is going up, something should come down. All right. So if during puberty, testosterone is supposed to be increased markedly to allow the growth of the secondary sex organs. Okay. Now, after puberty is over, there should be a balance, some checks to control the overproduction of testosterone. All right, so that the body doesn't continue to grow excessively, especially you're talking about testosterone. Then the penis will be growing until you can no longer even hold it. All right, so if after puberty the penis is still growing, then there is hormonal imbalance, and that should be reported.
Hey, Doc, this is Kingsley.
Yes, sir.
Please, with respect to the circumcision,
Yes.
is there any medical significance of it?
Yeah, you know that some people propose that circumcision will even reduce your sexual stimulation. You understand why? Because once you remove the listen, you remove the foreskin. Remember, we said that the foreskin is attached to the filum, the fumen, and that side is also attached to the corona, and the corona side is also highly innervated. So sometimes if you don't take care, by the time they remove it, and they have taken off all your source of stimulation. So some people think that okay, they don't even want to have, so they can enjoy their sexual, but it has been proven that whether you take it or not, it doesn't actually affect your sense of your capacity for erection. I'm sure that has been, if you don't remove it too, it's been also known that it is prone to infection. As we move along, we're going to talk about bilirubinitis. Okay, when probably if you don't keep that place clean, if you don't clean it properly, then it can attract a lot of, because you are going to urinate all the time, and if you don't take care, there are a lot of common urinary tract organisms that can be trapped under the foreskin, and therefore to give you an infection there, which we call bilirubinitis. All right, so those are the possibilities. But if you can clean the prepuce very well all the time, keep that place clean, and if you have a partner who also doesn't matter whether you have it or whether you circumcise or not, why not? Because it wouldn't affect your sexuality. It shouldn't also affect your male reproductive system in any way, as far as I know.
Hello, sir.
Well noted, sir. Thanks.
Okay. Any other question? All right. So we resume.
Yes, grandfather.
Hello. Yes, sir.
Are you saying that if you are uncircumcised, it doesn't affect your what is it? During sexual intercourse, it doesn't
No,
affect your.
it doesn't affect. You see, but it has some psychosocial effect. You see, when I say psychosocial, socially, women doesn't like. I stand to be corrected. Doesn't like uncircumcised penis. Okay, and you yourself, the man, you may also even feel shy. And so that gives you that kind of psychosocial effect. And as you do with erection has to be going to do what we call reflective erections, where you also have the psychological effect on erection. I mean, your psyche should also help you get an erection. If your psychosocial being is compromised, then it's also going to affect your erectile functions. That is what I think. All right. So these days it has become almost like constant that everybody should be circumcised. But if you are not circumcised medically, it doesn't give you any disadvantage. The only disadvantage is that you are prone to infections. And if you're able to clean your foreskin, the foreskin here, talking about the prepuce, clean very well all the time and blah, 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 it can be okay. And if, like I said earlier, if you are in cultural settings where the women there doesn't care whether you are circumcised or uncircumcised, then it means that you are free to go. But if you are, let's say, in Ashanti region here, and you are not circumcised, you go for a woman. The next day it is out there. Oh, this man cries, not circumcised, and then you yourself you won't pass. You cannot go out any longer. And those are psychosocial effects, but not medical. Not medical.
Sir, good evening.
Grandpa,
Yes, sir.
Yes, sir. Any other question?
Yes. Yeah, please.
Yes, please.
Okay. Oh, then
Please, I
you
hope I can be heard.
Will you continue?
Oh, Grandpa, please.
Okay.
I want to ask some question concerning the size of the penis.
Okay.
Yeah. So you said the penis stopped growing at the age
after
of
puberty.
18.
No. I said after puberty. So it depends on when an individual's puberty ends. So somebody's puberty can end because somebody can start puberty at age 10. If you start at age 10, puberty is supposed to be completed. It's a cycle. It's supposed to be completed by the next 5 years. So by 15 years time, it means that you are already matured. So your puberty is over. But of course, we have some people with delayed puberty, where puberty may not start until, let's say, 14 years or 15 years. Then it means that person, puberty is also likely to end after, let's say, 21 years, 22 years. If you take all those things into consideration, by and large, averagely by 21, almost, especially males, as for females, far shorter. Some females can start puberty at age 9, and later by 15 or 14, puberty has ended. But since you are dealing with a male, that's why I'm saying that males, the average starting point for puberty is 10 years. That's what is in literature. So, and by 21 years, almost every normal male will have completed puberty. I hope my point is clear there.
Yes, please.
I'm saying that after puberty, penile growth is unlikely. I didn't say it is not possible. I say it's unlikely. I don't know whether that point is clear. Because somebody asked, what about if it continues to grow? What I'm saying that if it continues to grow, it means that, remember we said that what triggers the growth is testosterone. And testosterone will peak within the pubertal period, because that's the period where the secondary characteristics are expected to what? Are expected to manifest. And so naturally, within the pubertal range of pubertal period, testosterone levels are very high in the adult. Sorry, in the young males. Okay, once it is over, and yet you are still getting enlargement in all the sizes of this thing, then you know that it is a hormonal issue. It's hormonal. That is what I'm trying to put across.
Okay. So please, let me finish the question. So please,
Yes, sir.
so you also said that the normal length, if the penis is in the flaccid position, is 3.5 inches, or that's
Yeah,
8.8.
about 8.8 centimeters. Yes.
Yes,
This is
please.
average. This average. Remember,
Average.
you're dealing with normal. I'm saying that you are dealing with a normal listing. We're getting to a point in the next stages, not rather in the other modules. We're going to talk about defects. Okay, so when we talk, for example, we talk about the penis, we are going to talk about the defects that can affect the penis. And that's where you come about. You also talk about the size. If the size is too small or too big, what will cause it? We have some penis which will curve as if it is even an S, or to curve to the left or to curve to the right. What is those? You also come to all those aspects, but now we're dealing with the normalities. We deal with the normalities, and I'm saying that once it gets to other modules, you're going to deal with abnormal defects of the. If you look through the orientation, the outline, we talk about the defects and abnormalities of the male reproductive systems. And over there, we're going to take them also one by one. Let's say we talk about the penis, we talk about all the defects. The defects will include the size. They're going to include the shape. How come that some penis shape as if it is to the left, or some of them will curve to the right. Some of them will give you like an S. What causes all those things? You come to that. So the size we are dealing now is about normal, and the figures I'm giving you are averages. Okay, so you know that when I talk averages, it means that there can be it can be a range. All right, but if the range is overboard, either way too low or too high, then that's also an abnormality, which we'll deal with them along the line.
So, Grandpa, my question is.
Hello, sir.
I'm listening, please.
My question is, so the people that have been using medications to enhance or to elongate their penis, does it work?
That's why I'm saying that you're dealing with what is medically recorded in literature. Okay, in literature, it's recorded that, for example, if you are at my age, for example, you don't expect the bones to elongate any longer. All right, but you can go to some places where they will tell you that they will put some medication and they will say that you will grow longer. Who am I to challenge them? Okay, so some of those aspects, for example, I've heard that people go for medications to make their penis bigger and longer and what have you. Me, I've heard it even when I was young, I heard it, but I haven't seen some feely. I haven't seen some myself. I don't know. All I know I've heard is that they go to a north, and those are where the medications are. I remember that even in those days, they will tell you that those medications, if you slap your thigh, then the thing, I can't challenge it. I don't know the science behind it, but I'm telling you what is scientifically documented in literature. Okay. I can't challenge them because I don't have any evidence whether it will go. But what I'm saying that what is medically recorded in literature is that after puberty, penile growth is unlikely. This one you can check it anywhere. That what triggers the penis to grow is the overwhelming increase in testosterone production during the puberty period. And remember, puberty period is where the secondary male or female characteristics also begin to manifest. And how do they manifest? They manifest because something from the brain will trigger the production of testosterone. Okay, and at that point, even though testosterone is also needed for the production of sperms, but at that point, the main preoccupation is for the production of the secondary male characteristics, and that will include the growth of the penis. All right. So I've said this over and over again that initially we said that the male reproductive system and also for the female reproductive system, they don't function until puberty. That one, why they don't function until puberty, we know that what is their major role? Their major role is to be able to procreate. The male will produce the sperms, the female will also produce ovum, they will mate, and then they will. So naturally, by nature, God has designed this thing in such a way that because the person cannot go through the process of pregnancy and all those sort of things, naturally, their functionality is delayed. The male and female reproductive system, their functions are delayed. As to why they delay, I'm telling you from basic distance, their main function is for procreation. Procreation, the time is not up, it's not due. So why do you activate them? So that's by nature, that's how it is. And once the time gets, once it gets to the puberty period, something triggers from the brain to produce hormones that will also begin to activate the secondary characteristics of the sex organs. All right. What I'm saying is that high testosterone production will not continue on infinitum. It won't do that. Because at a certain point, as we move to the semiology proper, you will see that testosterone level in blood will be reduced drastically because the testosterone will now be concentrated within the testicles because that's where they are needed. So all the testosterone to be produced will be concentrated within the. So we have the testicular levels of testosterone, which is about 100 times the level in serum. So if they are not in serum, how do they become available for the penile growth? So that one should even tell you, because testosterone, their main function once after puberty, their main function in the serum or in the blood is finished. The rest will have to be channeled through the sperm production, which is, and sperm production doesn't take place in the blood. It takes place in the testicles. So you have testicular high levels of test, and I've said this over and over again, that once you get there, you see that testicular testosterone is about 100 times the level of serum testosterone. So testosterone will not even be available in the serum for it to continue to facilitate the growth of penile growth. I think that should set the records. Is that okay? But in every circumstance, you know that something can go wrong.
Yes,
please. So
if
certain things grow, if there's some tumor somewhere that's also producing extra testosterone, then those extra testosterone will be available within the serum to also now cause an increment in your penis or whatever. That is also possible, but that is not normal. Okay. All right. So,
Grandpa.
Yes, sir.
Okay, sir. So there is this general notion out there that the way circumcision is done can affect the size of the penis. How true is that?
The way what?
A circumcision is done. How circumcision is done can affect the size and length of the penis. How true is that?
No. As far as I know, circumcision will not affect the size of the penis. What I know, and I've told you that if you have an inexperienced person doing the circumcision, the likelihood is that it's going to cause a lot of havoc to the your level of innervation. And I've said that the foreskin, the prepuce, is attached to the corona at the level of the frenum, which is also highly innervated. So once that happens, and a lot of the nerves are destroyed, then that is likely going to affect your erectile function. That one I know it can affect your erectile function. Okay, but even that one, you see that as you do erections, you see that there are various types, various pathways. There are various pathways for erection. So the neural pathway is there. You have vascular pathway, which is also there. You also have the psychological pathway, which is also there. So even if the nerves are destroyed, it will not exclude totally your capacity to get your penis functioning by way of erection. That is also my understanding. As far as I know, the growth is triggered by testosterone. That one is a fact. And I know that testosterone production suddenly increases in the serum during puberty, and that's where it triggers puberty. You know, in puberty, you know, that's where, if whether a male or female, that's where the sex organs develop properly. And it's triggered through the brain, by the brain. Like there seems to be like some clock, which will tell the brain to produce hypogonadotrophic hormones that will now trigger production of testosterone. So the testosterone becomes available for the and when we get there, you're also going to talk about the functions of testosterone, and you appreciate that testosterone, apart from sperm production, is also very much involved in the development of the secondary sex characteristics. All right, so that is how come penile growth becomes enhanced during the puberty range, because before puberty, testosterone, which is needed for the penile growth, is not available. Okay, and then after puberty too, testosterone will be channeled to another source. So you see that the testosterone will also become not available. So if testosterone, which is needed for penile growth, is cut off before puberty and after puberty, the reason why it cuts off before puberty, I'm sure you know it. The reason why it's also cut off after puberty, you also know it. So once hormones are not available, then you see that penile growth is also almost halted. I think you have delved on this for a long time. Don't get worried. Whichever side you have, I mean, you can manage with it. Don't worry. Your partner should understand. or are the women complaining? The women are complaining about the size.
No.
Are the women complaining about the size?
No, Grandpa.
So don't worry. Whatever size you have, is manageable.
And then, after Grandpa, you said something about.
I'm listening, please. Hello. I'm listening.
Your point.
I can't hear you, please.
Hello.
Yes, sir.
Just to add to your point, you said professionals do the circumcision.
Yes.
And what I know is when it is small, at the very tender age, normally they don't touch it. They allow the child to grow a little. When when it has grown a little, then they can cut off the foreskin.
Okay.
So it doesn't affect any future prospects.
Okay.
Thank you.
Okay. Thank you. Right. So now let's move on. We have some 15 minutes. We will finish with some up to a certain point, and then we continue tomorrow. So we're still on the penis, but now we are into the male urethra anatomy. Remember, we said that this is the physical aspect of the penis. We are also going to do the histology of the penis. All right. I mean, the real tissues that make up the penis. We will come to that. But now we've done with the physical aspect. Let's deal with the urethra. Then we come back to the main tissue structure of the penis. Of course, you all know that the urethra is the tube or tract that lies within the penis. Its external opening, which we said already, the external opening, the orifice, that's where the urine and semen exit the body. It's called the urethral meatus. Meatus, meatus. It generally lies at the tip of the glans penis. Take note of that one. Normally, it will lie at the tip of the glans. And we said that the glans penis is the head of the penis. It will usually, the meatus will actually be seen at the tip. However, in some circumstances, you get it in other positions, which we said normally would be along the raph. Okay, that's why we said it was important to appreciate where the raph is, and then once it comes to the abnormal positioning of the urethral meatus, you appreciate it from that angle. It said that the penis had a dual function, all right, because it's used for erection, for penetrative sex. It's also used for urination, but the urethra is performing the same function. The urethra that's the tract or the tube. That is where your urine is coming from, and also the semen is coming from. So it also has a dual function. But you see that those who do electrical wiring, they have something we call a conduit. Have you heard that? They say conduit wiring. Have you heard that before?
Please.
Yes,
please.
Conduit means within. So if they have a wall, they'll try to cut within the wall and push it inside. So that's conduit. So we say that the urethra has a dual purpose conduit because it serves as a dual purpose conduit because it is not like the penis as you see raw. It is within the penis. So it is a conduit. All right. So the urethra serves as a dual purpose conduit. Of course, carrying urine and then also carrying seminal fluid. So the dual function exemplifies the penis role. We say the penis role is for reproduction and excretion. So the urethra is also serving the same purpose, and therefore it is also called urogenital tract. Remember, we said that the penis is an organ, so that was a urogenital organ. So this is a tract, and so it becomes a urogenital tract. Now the urogenital can be used, it can be interchanged, so it can be genitourinary or urogenital, whichever way you like it. But if it is about the urethra, it is urogenital tract or genitourinary tract. If it's the penis itself, it is urogenital organ or genitourinary organ. Good. So let's look at this anatomy of the urethra. So the urethra is anatomically divided into 3 segments. Remember, the penis was also anatomically divided into 3 segments. We had the root, the body, and the glans or the head. So anatomically, the urethra is also divided into 3. Now, if you look at this as the urethra, you know this is the bladder. Look at this picture. The bladder is here. And then from the bladder neck, the neck of the bladder to the outside, which we call the urethral meatus. The whole tract here is the urethra. But this portion lies within the prostate. So it becomes prostatic urethra. It is important to note because even though the whole thing is urethra, but the functionality, the things that happen along the side is different from the things that happen along the side. It's also different from the things that happen along the side. All right. So it is important to appreciate that the portion that lies within the prostate is called the prostatic urethra. Now, there's a small segment here we call the membranous urethra. You'll talk about that one later on. So there's a short moment before you join the one which is along the penis itself. So because it is along the penis, the penile tract, then it becomes penile urethra. So we have the membrane, the prostatic urethra here. You have the membranous urethra, which is joining the prostate and then the penis itself. So this is the membranous urethra, and then of course the penile urethra. All right, and then the outside here is the urethral meatus. It is important to know this. Now, histologically, the lining is also different along the line. And look here. So remember that whenever you have an epithelium, for example, if I have an epithelium from one segment, it doesn't end abruptly for another epithelium lining to it fades off gradually and then takes off from another end. I hope you know this already from basic anatomy. All right, so
yeah,
the skin of the penis, our skin is lined by the stratified squamous epithelium. That's what everybody knows. So this is the tip of the penis. Do you think that the squamous epithelial lining will end at the tip here? No, it will move in a little bit before it gives into the another line of epithelium. So the skin that is the epithelial lining of the skin will not end at the meatus here. It will move in a little bit at the bulbous area of the urethra here before it gives off. You understand? So that is why it is important to know that this place is squamous. It's like the skin. Somebody's mic is on, please. So you realize that this side, the bulbous side of the urethra is also lined by the lining of the skin, which is the squamous stratified. And you know that our skin doesn't peel off easily. So therefore, the tip here doesn't also peel off easily. So if you have, and this is useful in urinalysis, if you have urine, okay, and within the urine, you do your urine analysis and the deposit, you're seeing a lot of squamous epithelial cells. Straight away, you know that it's a female urine. You know that. Straight away, it should be female urine because, no, along this tract, along the urethra, where do you have squamous epithelial? Where do you have squamous epithelial cells? Here coming. You see that this is urothelium. Urothelium is the lining of the bladder, and it will also stretch up to the prostatic region here. This is the pseudo-stratified columnar epithelial cell. This lining the pinna, this one here. This is the small portion that have squamous epithelial cells. Okay, and you know that squamous epithelial cells do not, it's just like the skin, that they don't peel off easily. So it is very unlikely to have this side, this small side. I hope you are seeing where my pointer is.
Yes, please.
Yes. So by this structure, you see that the squamous epithelial cells is a continuation of the lining of the skin, which is the glands, the covering of the skin, also of the glands, the head of the penis. It's part of the skin. So it is this part which is also moving in a little bit up to this point. So up to this point, you have the squamous epithelial cells. So if I have urine from a male, it is very unlikely to have a lot of squamous epithelial cells because if squamous epithelial cells don't even peel off. They don't peel off by heart. So you have only occasional ones which is peeling off into the urine. Now, what about the female? Female urethra is short and opens into the vagina. All right. So invariably, you have what you call exfoliation. Exfoliation in exfoliation is the peeling off. Okay, peeling off of a skin. You see the if you do pap smear, if you take pap smear from a female, all you do is to collect the sampling. It's collecting exfoliated epithelial cells from the vagina, and of course from the cervical area, because naturally the vaginal wall is lined by, the vaginal wall is also in continuation with the skin. That stratifies squamous epithelial cells, and naturally they have stratified so that the thrust, the to and fro of penetrative sex will not destroy the vaginal wall. So the vaginal wall is lined by squamous epithelial cells, but naturally they peel off. That's why a man so that the cells that are peeled off into the vagina are washed off. So naturally, there are squamous epithelial cells that are always being peeled off within the vagina. And you and I know that invariably, if a woman pushes out urine, unless it takes very critical care, invariably about 90% of the time, the urine is mixed up with vaginal secretions. The urine is, in fact, mostly contaminated with vaginal secretion. That's why if, let's say, a woman has sex, and then after sex, even let's say he had sex last night, and the following morning he's bringing urine to the lab, you will see that there are sperms in the urine. All right. The sperms, did they go to the bladder or they go to the vagina? The sperms get to the vagina, but urine is coming through from the bladder to the urethra outside. So how come that you are having sperms in the urine of the female after sex? This tells you that vaginal secretions mix up with urine. That is as simple as that. And the vaginal secretions, the contaminants are usually the squamous epithelial cells, which are naturally lining the vagina, which has exfoliated, which have been peeled off. You see, and that's why we also call it desquamation. Desquamation. You see, I was telling you that the prefix D means what? The prefix D, what does it mean, please? You can tell me. Medically, the prefix D means what?
Remove.
Remove. And then squamous. So when I say desquamation, desquamation means removal of squamous cells. Okay, so the desquamated cells, that's the natural lining of the vagina is squamous epithelial cells. Okay, now this one all of us know, but there's that natural exfoliation or desquamation. And I'm saying desquamation means the removal of the squamous cells. Desquamation, squamous cells, DE squamous. So desquamation. So the cells are desquamated. And if a woman doesn't wash the place for 2-3 days, I'm sure the woman cannot even eat. The scent that will come, you cannot even bear it. So there's that accumulation of squamous epithelial cells, the desquamated epithelial cells that are naturally there. And I've said that, I gave you an example that if a woman has sex, and then later on he goes to do urine analysis, naturally you see sperms in the urine. The sperms was not released into the bladder of the female. The sperms were released into the vagina. And the urine is also coming from the bladder to the urethra outside. How did the sperms get in there? So I'm just trying to use that one to explain the fact that things in the vagina will mix up in the urine. And this includes the desquamated or the squamous epithelial cells, the natural squamous epithelial or the vagina, which is mixing up with the urine. So if I'm doing urine analysis, I'm seeing a lot of squamous epithelial cells. What will make me think that it is a male urine? What will be the signs for me to say that, oh, this is a male urine? So if I'm seeing a urine, and then sometimes when I was in practice, they say, oh, grandpa, or a visa. I'm not a visa. You are only applying the science. If I'm seeing a lot of squamous epithelial cells in the urine, automatically, scientifically, it should be a female urine. And as simple as that. If it happens to be a male urine, it will be very doubtful. Very, very, very doubtful, because the structural anatomy of the urethra has just a small portion of squamous epithelial cells. And you and I know that squamous epithelial cells is very, very, it resists even erosions. So how come that you get urine from the bladder coming through and passing through here and releasing a lot of squamous epithelial cells into the urine. It's not possible. If anything at all, to be very, very scanty, 1 or 2 occasional squamous epithelial cells in the urine, then you can say, okay, this is likely to be a male urine. Otherwise, if I'm seeing a lot of squamous epithelial cells in urine, automatically it should tell me that it's a female urine, and that's what I've tried to explain. So as scientists, you have to know some of these things, and that will help you to. So, for example, if a patient produces semen, okay, a patient produces semen, and then within the semen, you are seeing squamous epithelial cells in the semen. What will it tell you? It will tell you that the urine was the semen was produced through sexual intercourse. Meanwhile, if you're doing semen analysis, we advise that the patient should not have sex. You see, so that's why I'm saying that it's important to have understanding of some of these things as the basic knowledge, and so that it can be used to explain certain aspects of your semen analysis. Is that all right? Is somebody getting me?
Yes, please.
Yes, please.
Right. So squamous epithelial cells from the male urethra is just a little portion, just this small portion, which is in continuation of the skin. All right. And they don't peel off easily. They don't peel off easily because they are like the epithelials, they are the stratified squamous epithelials of the skin, which doesn't peel off. But the ones in the vagina is a natural phenomenon, so that there always be fresh epithelial lining in the vagina, so that you and I can enjoy. Okay. All right. So that's just by the way. So we have the prostatic urethra, which I've told you, and then it is important to know that there is a point. All right, let's move on. So this is the portion of the urethra that traverses through the prostate. That's the prostatic urethra. It originates in the region of the bladder neck, and it is the longest. Sorry, it is 3 to 4 centimeters long and widest and most dilatable. Good. Let's go back. So this is the portion we are talking about. That it is the widest. Okay, it is the widest. It lies within the urethra, because over here, you are going to, as we move along, you are going to have the urine coming through. You're also going to have the ejaculatory duct also pushing through to bring in the semen. All right. So this place is wide enough to be able to accommodate the urine and then the distance. So this place is wide, very wide. Okay, very wide. And this one is coming in, and this one is also coming at the point it is going to also accommodate or also receive the ejaculatory duct where the semen is. So it gives a certain triangle, which we call the posterior urethral triangle. It's very, very, very important. So that one is very important, especially for the urologist. So once the urologist is doing prostatectomy, removing the prostate, you are aware that this is a certain angle in there, and you should know how to cut, because if there's a certain angle and you are also cutting straight, as you are cutting straight, you are likely to destroy that angle. And so that at the end of the day, the person can have a malfunction of either the ejaculation or urinary flow. Okay, so I've said that we are not going to go too much, but that certain aspects you must know. All right. So like I said, it receives the ejaculatory and then prostatic ducts, which transport semen. All right. So let's quickly finish up with the membranous. So this is also the shortest part. It also follows the prostatic urethra. All right. It is distensible. sorry, the least distensible. You remember that we said that the prostatic urethra is distensible. I mean, it can stretch. All right, but this side is not distensible. And it connects with the prostatic urethra and then the penile urethra. So the spongy or the penile urethra, this is the final and longest segment of the male urethra, measuring 15 centimeters in length in the flaccid state. All right. It runs through the entire penis and extends from the end of the membranous urethra and terminates at the external urethra, which is the meatus. Remember, it is also divided into the pendulous urethra and then the bulbous urethra. Let's go back. So when you say something is like a bulb, I hope you appreciate that one. So this is the spongy or the penile area, the penile urethra. Now, you see that this side is straight, but here within the gland, it is also it's also like a bulb. It's like it is enlarged. So this is this side is the entire penile area, penile urethra, but this small part still of the penile area is called the bulbous urethra because it is also enlarged, and you explain why that side is enlarged. All right. Now, as we move along, you see that this is an erectile tissue. This is also an erectile tissue. Okay, this erectile tissue is the same thing as the one that is also lining here. But the one which is also housing, there's also under erectile tissue, also housing the penile urethra. Now, if you get to this end, you see that this tissue here, this erectile tissue here is absent here. Once it is absent here, this one push pressure on the urethra here. So it narrows it. Here, there is nothing here. This is as you move along, you see that this is the corpus cavernosum. There's nothing of this here. So there's less pressure on the urethra here, and therefore it is able to move out. And it's able to bulge out. And that bulging out allows the flow of what do you call it? Flow of urine or semen, as the case may be. So these are very important information that you have to understand. I think we have also explained already that the epithelial lining, okay, where the prostatic urethra has transitional epithelial cells, which is called the urothelium. You know, the urothelium is the lining of the bladder. So this also a continuation of the bladder lining up to the prostatic area. The membranous area has stratified columnar or pseudostratified columnar epithelial cells. And then the penile area has stratified columnar epithelial cells. The last portion has stratified columnar epithelial cells, which we have described in this picture. All right. So it's important to appreciate all these things so that you know if somebody is producing urine or producing semen and there are cells in there, you'll be able to appreciate what kind of epithelial cells they are and where they are likely to be coming from. And that one can also be used as information to explain certain conditions that is affecting your semen. All right, so we will end here. God willing, tomorrow we are going to talk about the tissue structure of the penis. Right. I'm sure some people are sleeping already.
Thank you, Grandpa.
Yes, sir. How many of you were able to stay on throughout?
We're able to stay.
Some two or three have left already.
Yeah, some have left.
Some left because I don't know whether they were still feeling sleepy or the talking was too much. So let's ask questions.
No, the network was also unstable. Sometimes on that.
Okay. All right. So if you have a challenge, let me know, because we need to understand some of these things. Like I've said, these are basic information that we must acquire so that as we move along, you'll be able to appreciate and understand the bigger things. I think at the latter part, I think I was going too fast, but if you don't slow me down, you move fast. So if I'm going too fast, you have to. All right. If there's no question, give me tomorrow.
Okay.
All right. Good night.
Good night.